All right, so today we're diving into something that's super relevant if you're dealing with, maybe facing a tooth extraction.
Oh, yeah, definitely.
It's something that a lot of people don't think about, until they're right there in the dentist's chair, and then it's kind of like, wait, what?
Right, exactly. Could feel like a lot to process.
It is. So we're talking about bone grafting, and it's not just some random dental term. It's really about protecting your smile for the long haul, like keeping your mouth healthy for years to come.
I like to think of it as like an insurance policy for your jaw.
Yeah, that's a great way to put it. So in this deep dive, we're going to break down what bone grafting is, why dentists often suggest it, and the big things you need to consider if you might be looking at an extraction.
Perfect.
Okay, so let's jump right in with the why. Like, why is bone grafting even a thing? So right after you have a tooth taken out, dentists often talk about this preservation technique called bone grafting. And the main reason is to stop your jawbone from disappearing.
Yeah.
But why does that even happen?
Well, it's really interesting. Your jawbone, it's not just static. It's always changing, remodeling itself.
Oh, wow.
Yeah, and the stimulation from your tooth root plays a huge role in keeping it strong and dense. It's like exercise for your bones.
Okay.
So when that tooth is gone, that stimulation stops. And the bone in that area, it can actually start to shrink away. And that's a natural process we call resorption.
Huh. So, like, if you don't use it, you lose it.
Exactly.
And we're not just talking about like a teeny tiny change here, right?
No, not at all.
This shrinking can actually change the way your face looks over time, like your facial structure, and it can affect the health of your other teeth too, right?
Absolutely. Think about it. You've got this gap where the tooth used to be, and the teeth next to it, they don't have that same support anymore.
Oh, right.
So they might start to shift, tilt, move into that empty space, and that can lead to, a whole bunch of new dental problems.
Oh, I see.
And did you know, in that first year after you lose a tooth, you could lose up to 25% of the bone volume in that area. That's a huge change.
Wow, that's a lot.
Yeah, so it's not something to take lightly.
So this is where it gets really interesting. It's not like there's just one type of bone graft,
Oh, right.
There are all these different materials that dentists can use to rebuild that bone that's been lost.
Right, and it's kind of like, having different tools in a toolbox. You choose the right one for the job.
So, like, what are we talking about here?
Well, there's bone that can be taken from your own body, and that's often considered the gold standard, because it's your own tissue. It's the most compatible.
Makes sense.
And that's called an autograft. Then there's allograft, which is bone from a donor, another human.
Oh, okay.
And xenograft, which is often from, bovine sources, like cows. And then there are all sorts of synthetic materials, too, man-made. And each one has its own benefits and drawbacks.
So it's about finding the right match for your situation. Now, one of the big reasons that bone grafting is so important is because of dental implants, right?
For sure.
Like, these materials can create a solid foundation for an implant to go in later on if you need to replace that tooth.
Exactly. They basically act like a scaffold, encouraging your body to grow new bone in that area.
Yeah.
Making it nice and strong to support that implant. And that's why, if you're thinking about an implant in the future, having that bone graft done right away can make a huge difference.
So for our listeners out there, if they're facing a tooth extraction, why should they really consider bone grafting? What are the big takeaways?
Well, like we've been talking about, the main thing is preserving that jawbone.
Right.
And that means keeping your other teeth from moving around and getting all crooked,
Yeah.
And preventing that sunken in look that can happen when you lose bone in your jaw.
It's about keeping your smile looking good.
It is.
And feeling confident.
Absolutely. And then, like we said, if you're thinking about an implant, having that bone there makes it much more likely that the implant will be successful and last for a really long time.
Okay, so let's get to the big question here. If someone's having a tooth pulled, do they absolutely have to get a bone graft?
Well, that's where it gets a little tricky. It's not a one-size-fits-all answer, unfortunately.
Okay.
It really depends on your specific situation.
So there's no magic yes or no.
Right. It depends on things like which tooth is being extracted, how much bone is there to begin with, your overall health, all sorts of factors.
So what's the most important thing for our listeners to do?
The best thing, really the only thing, is to talk to your dentist.
Yeah, makes sense.
They can look at your x-rays, examine your mouth, really get a sense of what's going on.
Right.
And they can understand your goals too. What you want for your smile in the long term.
So they can help you decide if bone grafting is the right move for you.
Exactly.
So in this deep dive today, we've learned a lot about bone grafting and how it can help after you lose a tooth.
Right.
And it's not just about filling a space, it's about, protecting your jawbone, keeping your smile looking good,
Yeah.
and making sure any future dental work, like implants, will be successful.
Exactly. It's about thinking ahead and making sure you're setting yourself up for a healthy smile for years to come.
So here's something for you to think about. Losing a tooth, it's not just a one-time thing. It can have consequences down the road. But bone grafting, it's like a proactive way to manage those consequences. So definitely talk to your dentist about it and make sure you're getting the best care for your smile journey.
I couldn't agree more.
Great chat.
Yeah, thanks for having me.
Of course.